Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, hand joints and the diseases. Hand joints versus diseases, if we see. First, if there is only if you see only proximal interphalangeal joint involvement, it can be rheumatoid arthritis, it can be osteoarthritis, or it can be psoriatic arthritis. Okay, any of these. If it is given that proximal interphalangeal joint plus distal interphalangeal joint is involved, remember that distal interphalangeal joint is paired in rheumatoid arthritis. So if it is proximal plus distal interphalangeal joint involvement, so obviously it is not rheumatoid arthritis, so it is osteoarthritis and psoriatic arthritis. Then then if you see, then the next is proximal interphalangeal joint plus distal interphalangeal joint plus metacarpophalangeal joint, along with the, if wrists are involved. Okay, proximal interphalangeal joint with distal interphalangeal joint, metacarpophalangeal joint and wrists. Remember, in osteoarthritis, actually metacarpophalangeal joint and wrist joints are spared in osteoarthritis. Wrist joints are spared, metacarpophalangeal joint and wrist joints are spared in osteoarthritis. But if in the question it is given that there is proximal interphalangeal joint with distal interphalangeal joint with metacarpophalangeal joint and wrist joints are involved, then definitely all the four are involved, so it is not osteoarthritis, it is psoriatic arthritis. If it is given that there is proximal interphalangeal joint involvement with distal interphalangeal joint involvement with sparing of metacarpophalangeal joint and the wrist joint, along with that involvement of the thumb base, if there is involvement of first carpometacarpal joint or thumb base, then it is osteoarthritis.
thank you and thank you for watching.